Hi, I'm Janet. Welcome to JanetsHUB, celebrating you every version. Today I'm here at the Institute of Aesthetic Surgery in Altamont Springs, Florida with Miss Cindy Holden, who is a licensed medical esthetician, and she's going to explain and demonstrate the HydraFacial.
A HydraFacial is a medical grade facial resurfacing treatment that takes 30 minutes with no downtime. It works beautifully on all skin types, and the key is the patented vortex tip for delivery. The key also with HydraFacial is it creates healthy, hydrated skin.
Awesome, I'm excited to get started.
Sounds good. Let's do it. Okay, so today I'm going to do a HydraFacial treatment on Janet. First, I'm going to go ahead and cleanse her twice just to make sure I've removed all of the makeup before starting. It usually takes 2 cleansing to get the skin completely clean and free of the makeup. Okay, so we're going to go ahead and start now. Again, as I spoke before, the key here to HydraFacial is the patented delivery tip system, which is right here. This is going to help expel out the beta-hydroxy, the alpha-hydroxy acids, and then of course with a little bit of vacuum to detoxify the skin and remove the debris within the pore. So first we're going to go ahead and just wet the skin with the solution, because I'm going to be doing a sweeping motion, which is a lot like a newer generation of microdermabrasion. So we're going to go ahead and just wet the face, and as you see here, I'm doing the sweeping motion much like the microdermabrasion. So what Janet is getting is she's getting a deep cleansing, but also exfoliation as well at this point. When we finish the treatment, you will see in a reservoir all of the debris and dead skin and oil that's been removed. Okay, so I do 2 passes of this. That way I thoroughly touch all parts of the skin 2 times. And as you may notice, Janet's skin is getting a little bit pink and rosy. That's showing good circulation and good stimulation. So now we're going to move into the second step, which is a peel. This is a very light peel. It's beneficial for all skin types. It's a 7.5 glycolic and a 2% salicylic blend. Okay, so now I'm going to paint like little feather type movements. This is dispersing that blend of acid onto the skin. Again, it's at a low level, so there's no downtime. So with this treatment, you're really getting more than one deep cleansing treatment within the facial. You're getting newer generation microdermabrasion, you receive a light peel, deep cleansing with extractions, and then infusement of antioxidants, peptides, and hyaluronic acid to finish the treatment. Alright, so the next step, we're going to move into the extraction process. Again, going back to the patented tip delivery. She's going to feel a little bit of vacuum, and this is going to help to dislodge the debris that's deep within the skin. Again, this is a painless way of doing extractions. So I'm going to concentrate mostly on the T-zone, or anywhere the patient may have some breakouts or excessive oil congestion. Up to this point, the oil, the congestion, the dead skin cells are being softened. I call it loosening the mortar between the bricks, so that when I do the extraction, such as I'm doing now, the debris is dislodged very easily. So now I'm going to move into taking a look at the skin underneath the magnification. So if there was anything that was not removed with the extraction process, I'm going to go ahead and take it out manually with an extractor tool. Okay, so now that the skin has been properly cleansed and we did the light peel, and the skin's been detoxified through extraction process. Now we're going to go ahead and infuse antioxidants, peptides, and hyaluronic acid deep within the pore. Okay, so as you can see, I've thoroughly drenched her skin. Now I'm going to apply an LED red light, and that's going to push that product deeper within the skin than what I could manipulate with just my hands. By the time I finish doing the LED red light treatment on Janet, all of the ceramides, peptides, antioxidants, and hyaluronic acid will be fully penetrated into her skin. Okay, so I'm going to go ahead and remove the goggles. And this is where I choose the appropriate serum, moisturizer, and sunblock suited for the patient's skin. The cost for the HydraFacial typically is $175 per treatment. Your first time, we always give you the VIP price of $150, $25 off your first treatment. If you do purchase a package, then there is a price difference as well. So if you buy 3 or 4, you will experience a $25 off treatment discount. Or if you buy 12, we are running a special right now, 12 for $1,500, which brings the treatment down to $125. This is an oil-free moisturizer I'm putting on you today, Janet. Pretty. I show the patient their skin.
Oh my goodness.
So you have a nice rosy glow. I always tell patients it looks like you've just done a yoga class. So that shows, again, good stimulation, good circulation. So I would tell a patient, in order to maintain their results of the HydraFacial and the professional exfoliation that we did today, that she should be on a regimen of tretinoin therapy, which is commonly known as Retin-A or retinol therapy. This is her homework at home, so that she continues to exfoliate that skin and she maintains the results that she received today from the HydraFacial. And so to also maintain the results of the HydraFacial, all of us here at the Institute of Aesthetic Surgery believe that a patient needs to be on a growth factor product. It is a protein for the skin, but as we age, we make less of it. So we suggest that you have a growth factor product that you would use on your skin twice a day. And growth factors, like I said before, is a protein. They heal the skin, they tighten the skin, and they build collagen.
And what is the cost for this product?
The cost for the TNS Essential Serum is $289.
And how long will this last someone if they use it twice a day?
45 days.
Okay.
Okay, so now I'm going to show Janet what we detoxified out of her skin.
Oh no. Ooh. Yuck.
Okay, so I believe that she is pretty much status quo. I see this on a regular basis from my patients. Typically it does look a little bit like lake water. It's kind of murky. What that is dead skin cells, oil, sebum, congestion. That's all been detoxified out of her pores. Okay. Well, thank you for being my patient today.
Thank
I hope you enjoyed your treatment.
I did.
Your skin is radiant. It looks beautiful.
You.
Just one extra tip, if you are using tretinoin therapy, commonly known as Retin-A, you want to wait 48 hours after you've had this treatment to resume. And also, if you are planning to have this treatment, you want to discontinue your Retin-A or your tretinoin use 2 days before.
Thank you, Cindy.
Thank you.
Thanks so much for joining us today. I hope you'll subscribe to my channel, click like on all my videos, and follow me on all my social media, JanetsHUB. And remember, beauty should be fun.